We are live. Hello and good evening, everybody who have been patiently waiting. Thank you. Um, we are here with Dr. Daniel Maryanovsky, and today's topic with the GDR free webinar series is clear and concise communication. I'm your host, Dr. James Tran, and we'll introduce Dr. Daniel here. Dr. Daniel is a leading cosmetic dentist in Melbourne and has a keen interest in helping those needing severe dental reconstruction, as well as those looking to achieve a beautiful smile. Dr. Daniel has made his personal commitment to perfect the art of dentistry. Graduating from La Trobe University with a master's in dentistry, Dr. Daniel went on to complete advanced training in cosmetic and reconstructive dentistry. Dr. Daniel believes in a relationship-driven approach to dental care and likes to take the time to get to know his patients. It is this personal approach and attention to detail which builds trust and gives Dr. Daniel's patients the confidence to have their smile taken care of. Welcome, Dr. Daniel.
Fantastic. Thanks for the warm welcome, James. You'll have to guide me a bit here. I know we're in a separate little window here. If anyone's got any questions or anything like that, I'm happy to try and make this as interactive as possible, which can be a bit hard on the interwebs. So, yeah, firstly, thank you so much for having me. I understand we've got a mixture tonight of some oral health therapists, some dental students, some maybe graduated, new graduate dentists and oral health therapists. So I'll try my best to kind of couch our discussion in a way that will sort of be relevant to everyone. I know we all share a common love for teeth, but if there's anything I would love for everyone to get out of today, it's just to hopefully give you guys a little bit of a passion, a little bit of a reinvigoration when it comes to how you communicate with your patients. So we're all good to start, James?
Yes, we are. Your slides are up and ready to go.
Fantastic. So just briefly, I graduated from La Trobe. Actually started general dental residency with Alex the year after we graduated, and he's kind of taken on the gauntlet since then. Do a bit of teaching at the uni, always learning myself, and I have a dental clinic in Bayside in Hyatt in Melbourne, and M Studio Smiles, which I've had for the last couple of years. So this outline today is really more or less an exact copy paste of the ideas that James gave me for this presentation. Thank you, James. So we're going to go through building rapport, and hopefully I'll give you guys a bit of a contrarian view on what it means to have rapport in a dental setting, something a bit different to maybe what you've been exposed to throughout university. We'll go through some specific kind of appointment workflows, have a look at a few specific conditions we can discuss, including finances. And we'll also sort of touch on how to talk to patients about our dental colleagues, both in good times and in bad. So thanks for the list, James.
You are welcome.
And if you hear any meows or barks, I've got a few pets in the room with me. So communication, what is it? What's interesting about the definition of communication, if we have a look here from Google's dictionary, it's that communication is not just about the verbal. It's not just about what you're hearing and listening to right now. It's the spoken, it's the written, and it's also all the other mediums. So there's also dimensions to communication. So I want us to be really aware of all the different ways that we can talk to our patients. And before we talk about it, we got to understand, why does it matter? Like, who really cares? And I think there's a few things we can agree upon. Number one is that as dental professionals, we have skills to impart to our patients. We have the ability to greatly improve their quality of life, to help them chew better, smile more, and feel more comfortable in themselves. And everything that we do, if you really think about it, in the dental setting, is really try to help patients move away from pain or towards joy. And I think that's a really good way to frame our conversation, and just in general, something to be aware of, that at the end of the day, as much as dentistry can be complex, when you put it simply, we're really only doing one of two things. And the other thing I think we can all agree on is there's a massive dental need out there. It never surprises me just how much untreated disease, even in the year 2024, still exists. And so we have to ask ourselves, if we can agree on those two facts, then what's stopping us from helping patients, get on top of this dental need? And at the end of the day, it comes to our communication. To help patients, there's really two things that need to happen first. Number one, the patient needs to become aware of their dental condition, if they weren't already previously aware. And number two, they need to be empowered to actually do something about it, whether that be to trust us with their care in the dental setting or to make changes at home. And all of this requires clear, concise communication. So what I want to impart to you is the ability to build immediate, instant, powerful rapport, which is a hugely beneficial and hugely powerful skill that I think is underutilized in dentistry. And I think the reason why it's underutilized is it starts from the way this topic is taught at university. Because at university, I remember in third year at La Trobe, I'm not sure they've since we since kind of redesigned the curriculum, so I'm not sure what the communication subject kind of looks like. But it used to be in third year and was run by this guy. It was a non-dental professional. I think it was a psychologist actually, and there was a lot of fundamentals about the tell, show, do, and gradual desensitization, and using common words as opposed to technical words and all this sort of stuff. But at the end of the day, we spend most of our time at university speaking as professionals, colleague to colleague, and we don't spend nearly as much time actually talking to real everyday people. And what happens is we start to develop this misunderstanding of what it means to build a connection with patients. Because we're told to build a connection with patients, we take a social history. And I still remember the first time I was on the dental clinics as a student on placement, and I was assisting one of my colleagues who maybe grew up typically very studious, wasn't necessarily the most natural communicator. And I remember when it came to doing the patient interview, he literally said to the patient, "Okay, Mrs. Jones, so I'm going to take your social history now." He sort of announced what he was going to do. And then, and a lot of us did that because we didn't know any better. And so I think we were brought up to think that building rapport with patients meant saying, "Hi, Mrs. Jones, like, tell me a bit about your hobbies, and oh, how old is your son?" and all this sort of stuff. And for at least the first few years after graduating, I thought that was the key to building rapport. And it took me a long time to understand that although some patients might like chit chat, and there's certainly no harm in it, and it's good to incorporate these sorts of things, at the end of the day, we're there as a health professional to help them and not as their best friend. And there's always going to be patients that you connect with, that you talk shop with, especially as you get to know them more and more. But ultimately, building a rapport with patients is not about discussing what tea leaves they like to buy from the supermarket. True rapport is about demonstrating expertise, and most importantly, true rapport is built on a foundation such that patients feel that they are being taken care of. If a patient feels taken care of, that equals this instant, powerful rapport that we're going to talk about. So all this other stuff is secondary. So yes, do I talk to patients about their weekend and where they're going on holidays? 100%. But that's not how I build a true connection with patients. Building a true connection with patients is about having them enter into that room and leave feeling like they are being taken care of. Now, how do we achieve that? The first and most important thing is we have to demonstrate expertise. For people to feel taken care of, they have to trust us, and they have to trust that we have their best interests at heart and that we're a skilled professional. And so I think that typically, there's a few, and we'll talk about this shortly, there's a few different examples here on I guess, what it means to be a professional. This is Google's version. I still haven't quite, I was going to get ChatGPT to generate some pictures for us, but I haven't quite cracked it yet. But demonstrating expertise, it really starts from before the patient is even in the room. It's the language that reception uses to book the patient. When they pick up the phone, they're saying, "Oh, hi, Mrs. Jones. So we'll make that appointment with Daniel. And what time would you like? Blah, blah, blah." Or are they saying something like, "Hi, Mrs. Jones. So I'm going to go ahead and take care of you, Mrs. Jones, by getting you scheduled with Dr. Daniel. Now, he's received extra further training in the area of XYZ, which I know you inquired about ABC. So I think he's going to be a really great, suitable option for you." Blah, blah, blah. Instantly that rapport, that trust, that understanding that patients start to develop even before they've met you is hugely unparalleled. And it translates to what happens in the practice. How's the nurse greeting the patient? I think a typical thing, there's a few things that sort of bug me with, there's a few common themes we tend to see. I train a lot of dental nurses with communication. I think a really simple one to talk about is what happens when we're running late. No matter how hard we might try to be on time, there's often going to be moments where we're just starting to fall behind schedule. And there's nothing I hate more than when a nurse comes out to reception to bring a patient through and says, "Hi, Mrs. Jones. I'm so sorry that we kept you waiting. I'm so sorry about that. Like, we're all ready for you if you want to come on through." And using all this negative language, when instead we could be turning that into sort of to something a bit more positive. Not that running late is positive, but instead of focusing on the negative, why not actually tell the patient, "Hey, Mrs. Jones, thanks so much for your patience. We really appreciate it. It's not usual we run behind, so we really appreciate your understanding." Even something as simple as that, these small tweaks in the words that we use, they really change the way our patients feel about us. So it is really accumulation of a lot of different things. Now, speaking of before the patient arrives, your mental state and the way you present yourself make a huge impact on your rapport and your ability to be seen as a professional. So I want everyone to think about their state of mind. When a patient is showing up, especially a new patient, for the first time you're meeting them, they might be nervous, they might be anxious, they might be worried about the financial aspect of their treatment. Maybe it's the first time they've been to see a dentist in 10 years. And maybe they've been waiting 20 minutes while you've been stuck knee deep in an extraction that was not going to plan. And maybe it's, 2 p.m. and you've just skipped your lunch break. And so you're a bit frazzled and you've got blood all over you and all these things happening all at once. But as soon as you have a new patient coming into the building, coming into your room, you need to make sure that you get yourself into the right mindset. This person has come here to trust you with their dental care, and so we need to show up for them. So you might want to do some breathing exercises. You might want to do, just take a moment to yourself to have some mental clarity, because it can be difficult when we go from telling someone, bad news, "Hey, Mrs. Jones, you need to have all your teeth extracted," to the next appointment is a 2-year-old child, their first visit. We got to be happy, bubbly, excited. So we got to make sure that we take a moment to ourselves before we bring the patient through to make sure we're in the right zone. Make sure our uniform's nice and clean. And that's just a general thing, is if we want to demonstrate expertise, people judge you by how you look, how you appear, how you smell, what cologne you wear, all these sorts of things. Do you have body odor? These are all really, really important. And this is, before we even get into the verbiage, you could be saying all the right words, but if you don't smell particularly good and you don't look particularly put together, then none of it really matters. And this can have a huge impact on whether or not patients trust you and actually go forth to make those changes at home that you've asked them to do, or to go forth and make those 3 appointments for the treatments you've recommended. So if we want our patients to take our advice, we need to treat our interactions with them seriously. So a patient shows up, and now we're going to start talking about how we can continue to build that rapport in the way that we manage our appointment flow. So typically at university, we're sort of taught your patient comes in, and the first thing is we start with the dental questions. And I think that's a really good approach. We start by telling them, "Hi, how can I help you, Mrs. Jones?" or "How can I be of service to you?" And then they start telling you, "Oh, I've got this tooth that's broken or that's sensitive," whatever it might be. And we start asking our dental history questions. How did it happen? When did you first notice it? I think you guys are probably really well across those sort of more dental questions. But it's these next few parts of the appointment flow that I think are often overlooked, which is, how do we actually take patients that, may or may not be aware of their dental condition, and how do we take them through the process of becoming aware and treating that seriously, and then actually inspiring them to take action. And I think the first thing is, when someone does raise a problem that they've identified themselves, it's really important to ask some probing questions and to understand in what way this has been a problem for the patient. So it comes down to those sort of open-ended questions that you guys are taught about at university. But I think specifically, it's really important for the patient in that moment in your dental chair to actually look introspectively, and for them to really consider, well, in what way have my teeth been a problem for you? So I think it's these sorts of questions are important. Like, hi, Mrs. Jones, so that tooth that you notice has chipped, in what way has that been a problem? And Mrs. Jones might say, well, it's been a bit sharp, and so I cut my tongue on it once, and it's kind of been annoying. But what's interesting is that often with these sorts of dental problems, there's lots of ways in which they create these sort of inconveniences or difficulties or challenges for our patients. And so it's really important to further prompt them. So after they tell you in what way this has been a problem, actually ask them, well, Mrs. Jones, I understand it's been sharp, but tell me, in what other ways has this caused you problems day to day? And you'll be surprised by the amount of times that Mrs. Jones will say, well, actually, Dr. Steve, now that I think about it, I don't really like how that tooth looks in photos. I just had my daughter's wedding and I noticed that it just really caught my attention. And actually, one of my nieces pointed it out to me and teased me about it. And this is where we should really sympathize with the patient and sort of say, yeah, look, that's not so nice. Like, I'm sorry that that's been giving you these problems. And then the next part, of the conversation is really, and again, this is all, I'm feeding you guys a few little tidbits. And this particular workflow that we're talking about is really specific to the scenario where patients are attending to the practice with a specific concern. But maybe they don't know, the whole story. They've got a concern, but they don't know exactly, just how bad it is. And we're trying to gradually raise their awareness and have them kind of treat their dental condition more seriously. And so it's great to ask probing questions. Open-ended questions are great. And once you've understood the problem, you've raised the awareness. We want them to understand, well, what are the implications of this particular problem? And so we want to ask, what do you think, Mrs. Jones? So if we didn't do anything about it, what's your understanding of what would happen to this tooth? Do you understand what the future might look like for this particular tooth? You want to get them thinking. I think intelligence in patient interviewing is about asking the right questions. And then before we jump to raising solutions with patients, we want to get a better understanding of like how significant is this to the patient? Like, how much do they actually care about this? And that's what we call the needs payoff. Asking Mrs. Jones, okay, well, look, Mrs. Jones, I understand that you have this issue and it's been a problem in XYZ way, and you want to summarize for them. And I understand as well that you've told me the implication. You're aware that if we don't treat it, that probably the tooth is gonna continue breaking. Is that right, Mrs. Jones? It's good to reflect back to them. Mrs. Jones goes, yeah, that's right. I'm aware. And then you lead her to the next step. So, Mrs. Jones, if we could find a way for us to repair this tooth, to make it feel better, make you more confident in your smile, in what way would that impact you? How would that actually help you? I want to understand so that we make sure we get the right result for you. And Mrs. Jones goes, oh, well, I'd just be so much happier taking photographs, and I've been meaning to play with my niece more often. So this will allow me to, book that trip with them that I was hoping to do, blah, blah, blah. So just a simple workflow, a few things to consider about how we can lead patients. And what's really important here is we don't want to give solutions. We want to ask intelligent questions. We want to listen, and then we want to inspire them to take action. That is the most powerful way to build and develop rapport. And once we've understood all this and we've taken the patient through the pain points, we've really got them to kind of dwell on these problems, then it comes to our turn. It comes to our turn to demonstrate and display our expertise. So this is where we take our records, our photos, our x-rays, our examination, whether that's by yourself, with your nurse, with your therapist, hygienist, etc. And it's important that often patients will come with, one concern, but what will happen is we'll find, well, actually, Mrs. Jones, I know you were worried about that chipped tooth, but what I've actually found out is it seems like there's a pattern of fracture in your mouth. And although it's only the front tooth that's broken, there are a number of other teeth with quite visible crack lines. And so you might say something like, Mrs. Jones, I've noticed a few other problems with these teeth. Would you like me to discuss those with you now, or at a later date? What would you prefer? It's always good to ask people for permission to share certain things with them before overwhelming them too much. And this is where we start bringing up our records. So patients don't really understand x-rays. So I think when we've got x-rays, we tell the patient what's happening. Hi, Mrs. Jones. As you can see, there's a cavity here. And this little shadow means XYZ. Pictures are different. People can understand pictures without dental training. So I think with pictures, the best approach is really to bring photos up. And if you don't already take photos, you really should. It's my cat here. Hey, Kiki. Do you want to say hi? She says hi. So what that means is bring up the photograph, and we'll look at some shortly, and bring it up, blow it up on the biggest screen you've got, show them and ask them, hey, Mrs. Jones, tell me, what do you see? And just sit back, shut up, and listen. You'll be amazed by how many problems the patient can diagnose themselves. And that process of self-discovery, I think, is really critical to patients taking ownership of their dental problems. And this is where we start to describe solutions. So, Mrs. Jones, for this broken tooth, we've got options A, B, C. You could get a simple plastic filling. That's option 1. Option 2 is you could have what we call a composite veneer. Or option 3, you could have a ceramic veneer. And you go through some of the pros and cons, etc. But the important point here is anytime we're describing solutions, we should be able to describe any procedure in 30 seconds flat. If it's taking you longer than that, you're just going to be confusing the patient and giving them more information than most people would find necessary. As with anything in life, everything is customized to the individual you're communicating with. So depending on the type of person they are, and if you're not already familiar with the different types of people, there's a few different, I suppose, these sort of like personality type tests out there. It's good to be aware of what are the different types of people we might be interacting with. Some patients are more visual, some people are more auditory, some are kinesthetic, and understanding, well, how does this person actually see the world? Through what lens do they look? Really helps us kind of give them the right tailored information. The way you talk to a plumber might be different to the way you talk to an artist. And it's very important, especially in the year 2024 and with everything that's happening with the economy, etc., that patients understand that, hey, look, most people don't have a lot of money hanging around. And so if you do need a lot of treatment or treatment that's more expensive, more involved, that, hey, payment plans are super common. And if you or your clinic offers them, try and normalize it for patients. I'll often say to a patient at the end of this sort of a presentation that, hey, by the way, Mrs. Jones, so over 80% of our patients might choose to go on a payment plan of some sort. And by doing so, they're able to get the treatment they need done now, but actually pay the treatment off when it's convenient for them over a 12, 24-month period. And as a courtesy, the clinic will actually pay the interest for you. So there's no extra fees for you. Let me know if that's something you'd be interested in. And at the end of the day, patients are after our opinion. So as much as we're taught to give all the patients and let them be the owners of their destiny, I think that at the end of the day, it's still important to give the patient your personal opinion. Because although there might be an option to do simple filling, a composite veneer, a ceramic crown, in your gut, you probably know which one is the best for the patient. And so you might tell Mrs. Jones, look, given your young age and the extent of fracture, I think that a crown right now may not be the best idea because it's a bit more destructive to the tooth. But that middle option of a composite veneer would be a good blend between aesthetics, but also longevity, which we might not achieve if we just did a simple filling. And so patients really appreciate your personal opinion. I think it's important to share it. Then to finalize our kind of consultation with the patients, we want to satisfy them. We want to make sure that we haven't left any unanswered questions. So ask them, hey, Mrs. Jones, tell me, have I missed anything out? What questions do you have for me? And now it's important, and I think this is a really important slight turn of phrase here, is you don't want to ask them, Mrs. Jones, do you have any questions? You want to actually assume. You want to assume that they do, because they should. They should, because you've given a brief explanation. And at the end of the day, everyone's got a different lens they see things through, and they're going to want to know more information about certain things. So you want to actually assume and not say, do you have questions? But what questions do you have for me? And it's very, very, very important that at the end of a long session like this, we summarize. So, Mrs. Jones, you came in to find out about fixing this broken tooth. We had a look at the photos and x-rays together, and you saw that there were quite a few teeth cracked, yes? She goes, yes. And we worked out that the best solution would be XYZ. And then you need to lead the patient to the next step because patients are not dentists. They don't know, if you still need to work up the case with a CBCT, or you need to have a specialist look at it, or maybe the dentist in the other room, whatever it is. You need to tell them, hey, Mrs. Jones, so the next logical step is going to be this, and keep it simple at the end of the day, because people are time poor, and we need to assume that of our 45-minute appointment with them, they're going to remember 3% of it. And that 3% will be whatever happens at the end. So keep it simple and summarize. Now, I've got a few diseases to sort of talk about if we would like. How are we going for time, James? Wait,
Yeah, we're going great. We're going great. Yeah.
Okay, cool.
We're about the 20-minute mark, 25-minute mark. Yeah.
All right, great. Well, I'll sort of, briefly go through these. At the end of the day, there are many ways to skin a cat, as the saying goes, and there's many ways to convey our conditions to patients. And everyone's got a different approach. Some people, and I think it's important to customize it. So with periodontal disease, how do we talk to patients about it? I'm just going to briefly run you through the type of conversation I would have with a patient that, their intraoral photos look like this. So I'd bring up the picture. Firstly, I would ask permission. Hi, Mrs. Jones. If it's okay with you, I'm going to bring up some photographs for you to have a look at, if you don't mind. And hopefully they say yes. You do get the odd patient that is a bit uncomfortable with that, which is why I tend to ask people. But I think it's really important. So I almost don't give them a chance, because I think if they're not looking at the pictures, then they're not taking ownership of their own condition. And so if they don't look at the pictures on day one, which is fine, the next time I see them, I'm going to ask them again. And I'm going to keep doing that until they're okay with me sharing the pictures, because I think it's psychologically very, very important for the patient. So assuming they allow us, hey, Mrs. Jones, so I've brought up this picture here. Now, tell me, Mrs. Jones, you probably don't need to be a dentist to see what's going on here. What do you think is happening with the gums? Sit back and listen. And just see what they say, and they'll diagnose it for themselves. And if they don't, this is where you come in either to affirm what they've said or to add. And saying something like, hey, Mrs. Jones, so obviously the gums are not looking great. So you can see how red and swollen they look. You can see the buildup on the teeth that's irritating them. And at the moment, what's happening is the gums are not only inflamed, but it looks like that inflammation has progressed to what we call gum disease. And by the way, Mrs. Jones, I don't know if you knew this, but gum disease is actually one of the most common conditions in the world. So they say something like up to 30% of the adult population suffer from some level of gum disease. So you're not alone, but we're not in a great place. So what's happened is, with this buildup over time, we've been unable to take care of the teeth and gums, and that's caused this buildup of plaque and tartar. So that's the bits of food and bacteria that get stuck to the teeth and harden over time. That's caused that buildup to migrate under the gums, and it's caused the gum and bone to shrink away from the teeth. And the worry is, as this progresses, the teeth are losing their support. And as this happens, the teeth start loosening, and eventually we may be looking at losing some teeth. Now, don't worry, Mrs. Jones, I'm going to take care of you. The good news is I've done a mapping of your gums, and it's looking like, although there are 3 or 4 teeth that are on the more severe side, the other teeth are in the moderate category, which means we should be able to still manage this and hopefully avoid you from losing any teeth. And, you continue to show them. And then if we're talking about the treatment for gum disease, personally, I'm a big fan, and I don't know if Alex is out there, but he'll like this. But with gum disease, anytime it's more than sort of mild gum disease, I'm always giving the patient the option of a specialist referral, which is just a personal thing. I think it's just important, especially because gum disease is one of those chronic conditions. And I think that's something that's really misunderstood by patients. So I'll tell them, hey, Mrs. Jones, so I need you to understand that getting on top of this condition is not easy. So gum disease is considered a chronic condition, which means there's no simple fix. There's no tablet you can take. There's no mouthwash that will magically cure it. this is going to be a chronic battle that you will have more or less for your whole lifetime to stay on top of this. Now, the good news is it's going to get easier with time, but at first we have to get things started. And really, you've got two options moving forward to maintain the gums. One is you can continue seeing us, and we see a lot of patients with mild to moderate gum disease. Or the other option is you could see a specialist. Of course, a specialist, this is the only thing that they do. So in some sense, they may be able to get you a slightly better result. However, the appointments may be a bit harder to coordinate, as often they're a bit booked up. And overall, it may be a bit more expensive for you. So it's up to you, Mrs. Jones. I will tell you that a lot of patients in your case, in the mild to moderate category, I find that most patients prefer to start their treatment with us. And then depending on how the teeth respond, the teeth and gums respond to the initial treatment, that is then how we decide whether to involve specialists or if your care is going to be continued with us. But I need you to understand we're going to start with this, what we call deep cleaning and gum disinfection, because gum disease is basically an infection of the gums. And that's where we numb your mouth and we're removing all this debris that's been building up deep under the gums. And as a part of this, we're going to be coaching you through some changes you're going to make at home. Because I always say that what we do here at the clinic is, 10% of it. 90% of the result is based on what we do at home. So there's a number of changes we're going to have to look at making if we want to get on top of this. Now, obviously, Mrs. Jones, the other option is to sort of give up because things aren't looking too good. There's some people that when they hear about this and they hear the costs and everything, they say, look, I think it's too much. But I need you to understand that if you're willing to put in the effort and make the changes at home and work with us, that this is something we can get on top of. And it's going to be the difference between you losing all your teeth in 5 to 10 years or keeping all the teeth and happily chewing, functioning, etc. What would you prefer? And sometimes I think, especially with gum disease, it's one of those where being frank with patients is really important. Because I think and I see so many patients that don't understand that this is chronic. This is something that is, particularly with a case like this, needs really ongoing maintenance. And I think from day one, people need to understand that. They need to know what they're in for. That, hey, Mrs. Jones, we're going to be doing these 2 sessions under numbing. It's going to cost you $700-800 each session. Depending on how things respond, we might need to do multiple rounds of this before we're on top of it. And then you're going to need to see us or the specialist about 3 to 4 times a year to maintain this until with time, maybe we can get you back to just seeing us twice a year. So I think that especially with gum disease, because it's chronic, you need to explain to them from start to finish here, what does this disease and the management look like, not just now, but over time? Because I see all too often what happens is patients get the initial treatment and they think they're fixed. And I see them 5 years later and they're like, yeah, I was treated for gum disease and I had this deep cleaning and I haven't been in 5 years now. And then we're back to square one, if not in a worse position. And it's because the patient, for whatever reason, either they weren't educated or they didn't fully comprehend just how this disease works. So I think with gum disease, that's really key. A little bit on that. A little bit on cracked teeth. It's interesting, and I think that a lot of people will agree with this as they have more experience. Maybe, James, you'd agree that... what do you think of your communication style, James? How's it changed over the years?
I do a lot of photography. I've cut down a lot of personal chit-chat. I keep it simple because I think the patients are there for just the chief complaint. And it's nice if you're friendly, but I'll try to keep it brief. While we're numbing up, I can have a chat, when there's a bit of downtime. I do a lot of photography nowadays. I think that helps. I think it's an adjunct, but I don't think you should be relying on photography.
What do you mean by that?
Well, not as a crutch. You can have the nicest photos, but if you're not connecting with your patient and talking your point across, just in case your camera dies, maybe it's not it. Maybe you as a person might need to improve or refine your communication skills, if that makes sense.
It's interesting. I'm a big believer in seeing is believing, and I think in the absence of a camera, there's nothing wrong with a mirror. but the patient needs to see, I think, dentistry, it's such a visual thing, especially in the absence of symptoms. I mean, obviously where the patient has symptoms, it's, they don't need to see anything because they feel it. But if they don't feel it and they can't see it, it's hard to believe that it's real and to understand the gravity of it, I think, to some degree.
I think I think it's one of the hardest things to communicate asymptomatic cracked teeth or asymptomatic periodontitis.
That's where I was gonna, segue into this is, and I'm curious to get your thoughts, James. But I often think about the fact that in dentistry, and whether we realize it or not, a lot of the treatments that we do and offer to patients technically really should be seen as elective treatments. And as soon as you have an elective treatment, the conversation and the art of persuasion, everything is different. Just everything's different. And cracked teeth are a great example. These sorts of teeth, because they're often asymptomatic, and we know what happens with these. Eventually, they probably crack in half, and then maybe we can fix it. Maybe we can't. Maybe they need an extraction, but maybe not. Maybe this tooth will outlive them. We don't know. We don't have a crystal ball, and so it's elective. And all of a sudden, I think the way that we talk about this with patients, I think that's important for people to understand. I don't know. Do you find over time, James, your communication approach, are you more authoritative with patients? Do you tend to tell them, Mrs. Jones, I'd really recommend a crown on this tooth because I'm worried it's going to break?
I think in some instances, yes. Like, especially the patient's very indecisive, but what they're asking you for their opinion. Even though I used to be, oh, it's up to you. You can do this or do that. It's up to you.
So what happens when they've got James, like 10 teeth in their mouth that look like this tooth? What are you telling them?
Well, it's still up to them, but I would still give them a choice. But then I would say, if it was me, if I was in this position, I would be doing this. This would be my recommendation, but it is still up to you what you want to do. But it is my recommendation to preemptively put crowns on these, or preemptively, get the deep clean done. That's my personal happy way to medium to talk these bigger treatments with patients. Yeah.
It's
so
interesting.
They know what I Sorry, go on.
No, I was going to say, I think with time and experience, a lot of us start to take on a more authoritative approach to communicating. Whereas starting out, we were very much taught, option A, B, C, pros, cons. It's up to you, Mrs. Jones. And I think the reality is there's no right or wrong, but I do think with elective treatments like these sorts of teeth where there's no symptoms and maybe the patient's 60 years old, so maybe this tooth could hang on for another 20 years before they cark it. I think it's important that the patients understand that. And so, typically with this sort of tooth, I might tell a patient, hey, Mrs. Jones, there's a number of cracked teeth. I see a pattern of fracture in your teeth, some of them worse than others. And it's really up to you. I mean, if they were my teeth, in an ideal world, protecting them with something like a cap, what we call a ceramic crown, would stop us from breaking and losing these teeth. So that's a great idea. There's also, a more modern approach, which is, what we call an onlay and blah, blah, blah. You could talk to patients about that. That's another topic, actually. Out of curiosity, do you tell your patients the difference between an onlay or a crown, or you just?
I when I start showing, when I bring out my laptop in my previous cases, I will, if they're semi-interested, I'll talk to them about it. And if they, and I'll go, look, it's more conservative, and then you can.
I'm with you on that. I just call everything a crown, even though I do like 1% of my fixed pros as crowns and 99% is partial coverage sort of stuff. Just because that's what people are used to hearing. But so we've got to be selective with what we communicate. But I think at the end of the day, you're right. The patients, it's up to them with teeth like this. So I'll tell them, hey, look, you could leave it. I often tell them, I think a good analogy, I talk about the lottery. I ask them, hey, do you tend to get a lottery ticket? Are you a believer? Because I think it's a bit like that, not treating these teeth. It's like holding onto a lottery ticket, and hopefully you're, the 1 in a million that kind of wins out, but probably you're going to be in the 99% that don't win. And I think a lot of people can connect with that. And, there's lots of great analogies you can use like that. And I tell them, hey, Mrs. Jones, so you got a few options. One is some patients, and I think it's always good to use social proof. It's a great, if no one's read, and we'll talk about in a moment, we'll skip to the end. We'll talk about where you can take communication from here, but there's some great books. Great one is Persuasion by Robert Cialdini. You familiar with that one, James?
I've heard many references to
No, it's not
Cialdini.
Persuasion. I think it's The Power of Influence. Forgetting the name. But yeah, so there's a number of great topics, texts on this, but social proof is really important. So I'd say, hey, Mrs. Jones, so in this case, I probably see that most patients would choose to put a crown on this tooth because they understand the value it can provide. However, there are some patients, you still want to normalize. There are some patients that would prefer to hold on to their lotto ticket and just see how they go. And even still, there are some patients that might prefer us to join the Crown of the Year Club, which is where they make use of their dental insurance and might have one of these teeth treated each year to make the most of the dental benefits. So it's up to you. To me, it doesn't make a difference. Sometimes being nonchalant is helpful. I know it depends on the patient, but I find sometimes it's good to say, look, doesn't make a difference to me. I just wanted you to be aware of this.
Yeah, I think that's an important point as well, because if you seem desperate to get that crown, like it's really good for you, you really should get this crown, it'll be really good for you, I don't think you should wait a few more weeks, I think you should get it done today. It sounds kind of desperate. Whereas, yes, I am less. Look, I don't mind you do it. You choose to do it or not. If it breaks, at least you know it's going to break, and that's your choice. So
yeah, and I think it's playing the long game with patients, is saying, yeah, Mrs. Jones, look, I'm happy. I know you don't want to. You've decided not to treat this, so we're going to keep an eye on it. And it always asks for permission. Is it okay, Mrs. Jones, when I see you next in 6 months, I'm going to take some updated photos, and we can have a look at the progression of the cracks then. You want to plant some seeds and follow up and that sort of thing. So I think that's good.
Yeah.
Money, I mean, this is a huge topic, but I think at the end of the day, it's just being confident to talk about money with patients. I think that, especially starting out, a lot of us are a bit nervous about it. But the reality is that people want to know what they're in for. And so it's important to be able to practice the skills of quickly estimating treatment accurately. Lincoln Harris runs a great course, and there's videos if you're probably shouldn't cross promote, but not that I'm a promoter for that, but he's got a good lecture. I haven't actually seen a lot of their content, but I have seen one of the lectures, which is on rapid, efficient treatment planning. And the only reason I bring it up is one of the things he talks about is the importance of being able to rapidly estimate things for patients. You've got a patient that needs 6 medium-sized fillings, partial cobalt chrome, 2 implants, and they're likely going to need their wisdom teeth surgically extracted. You should be able to estimate that in 15 seconds. And if you can't, then you got to study your numbers more. You got to get better at quick math, because when you do this treatment presentation, it's important to be able to tell the patient, hey, look, so in total, it's probably going to be, around 6,000 to 7,000, and make sure you're more or less on the money. I'm going to double check that for you, Mrs. Jones. Now there's options to spread the treatment out over time, or to go on a payment plan, blah, blah, blah. There's insurance. Be comfortable working with patients, especially in the absence of having a treatment coordinator type figure in the practice, which, depending on where you work, you may or may not have the luxury of. I know I did in my first job out of uni in Ballarat, and I didn't realize how much burden they took off me, because when I started my own practice, I went, oh shit, I gotta talk money with people. I'd never said a word to them about money. That was the treatment coordinator's job. I just waltzed in and said, hey, you need 3 crowns, and left, and magically the patient booked in. So that was a rude awakening. Don't throw people under the bus. No matter what you see, no matter how horrible the dentistry, it doesn't help anyone, not the patient, not yourself, not your colleague. If you see some crap dentistry, and even the patient will be like, oh, so like they did a bad job and blah, blah, blah. Like, whatever it is, you always just want to say, hey, Mrs. Jones, so it looks like they had a challenging treatment here. You want to use this kind of language. There was quite a big challenge because of XYZ. I'm guessing that moisture control in this area was difficult. And I can see it was your very last tooth, so the access was probably challenging. So I can understand why the result was not ideal. blah blah blah, and then divert. Just don't engage in that sort of stuff. It doesn't help anyone. And where to go from here? There's so much you can do with communication. I think NLP is a really interesting topic for those that are a bit more inclined to learn about the more nerdy aspects of communicating. Get involved in public speaking, listen to podcasts, and just reflect. Look back and have a look. Oh, why didn't Mrs. Jones book in for that treatment? Or how come she had her records requested? Like, that's kind of interesting. Like, actually go back if you're not already in the habit of checking your rebookings, at the end of each day, each week, check your cancellations, like really be in tune with, what patients are taking your advice and which aren't. So I think that's the way that we all learn. And yeah, if you have any questions, feel free to reach out. I'm temporarily off social media. So if anyone wants to email me, we are actually about to looking at hiring an associate. If anyone's looking for a part-time job in Melbourne, please email me. We've got all the technology, all the goodies. It's dan@studiosmiles.com.au. Thanks so much.
Awesome. Thank you so much, Dan. Very informative, and I'm sure a lot of people have learned a lot of things about communications and the difficulties in communication. So thank you again for your time. We don't have any questions at the moment. Just some thank yous here and there. That's fine. Thank you as well. I
don't even know where's this being streamed to? Facebook, YouTube.
YouTube. Good on YouTube. And then we'll have a replay available to those who can't make it today. I think that's it for now. We'll just see if there's any. We do have a question here from Dr. Taladi. Could you talk about how to break bad news to patients?
Yeah, I think the best way is just to be honest. At the end of the day, that's all we can really do, to be honest. So sometimes a patient the other week on the topic of gum disease, a young guy in his probably early 30s, late 20s, probably going to lose all of his teeth in the next 5 to 10 years. Really aggressive periodontitis, immaculate oral hygiene, immaculate. And he knows that he has gum disease, but no one's really taken the time to be frank with him about, well, where's this really going to leave you? And so I think the best way is to be sympathetic and honest. So can't remember his name. Let's call him James. So, I'd actually, no, that's bad karma. We'll call him Jim. So I'd sit Jim down and be like, Jim, so I want to be honest with you. I know you're aware of your periodontal, your gum condition, but I'm going to give you some information today about the extent of it and what the future might look like. Because I don't really understand your full comprehension of where it's at, because at the moment it's not looking great. And what that means, Jim, is at the moment we've seen 60-70% bone loss. And at the current rate it's progressing, it seems likely that we may be facing the loss of many teeth in the next 5 to 10 years. Now, obviously that's a hard thing to digest, but I want you to understand that we do have options in this case to help you manage this. So you want to sympathize, you want to still give them confidence and inspire them to be like, okay, although things might look hopeless, there's still a way. We do have dental implants these days, or if that doesn't work out, there's still the option of dentures, Jim. So I want you to understand that you'll never, at least under my care, you're never going to go without teeth. So we're going to look after you. But our priority now is going to be just trying to delay the inevitable as much as possible. And that's where that range comes in. That could be you in dentures or dental implants in 5 years, could be 10 years. I'm hoping it's longer, but this is quite an aggressive disease, etc. So being frank, sympathetic, and you may have noticed there I lowered my tone of voice. I spoke a little bit more slowly, more methodically. The pace that you're using, which we haven't spoken about, but as far as communication, there's so many dimensions to the way that we speak. that I think often go amiss, that can really change the way people perceive what you're saying. So yeah,
I agree with that, and especially with the slowing down, speaking purposely. I've got a very bubbly personality. I think extroverted in terms of when I interact with patients, but when it's something like a serious talk, I will slow down. Really, when I break the bad news, or if I feel this tooth is questionable in terms of its prognosis, or I think this endodontics might be hard, or the extraction might be a bit difficult, I will have a proper sit down and tell them, I think it's going to be really hard. Maybe you should see a specialist, or there's a chance that you could get a root fragment broken and might not be able to retrieve it, and you might still have to see a specialist. It's all about the consent, and this is talking about preemptively guessing potential bad outcomes during a procedure. So a lot of consent as well. In that conversation before you start, I think that really helps with that, minimizing that, having that conversation afterwards where actually something happens like a broken file, then you got to tell them afterwards, oh, by the way, it's broken. I forgot to tell you about it beforehand. So it's all about preemptive guessing.
Yeah, it's sort of, you want to have give them reasons, not excuses.
That's right. Exactly it. We have another question here from Dr. Laura. How do you communicate about oral lesions and not scaring the patient that it's potentially malignant?
So I think the key operative there is potentially. And the reality is, if something's potentially, then why are we scaring someone? So unless you've got the confidence and you're quite certain of what it is, there's no reason to scare someone. Beyond, obviously, you need to raise enough concern for them to take action, to take that next logical step. But outside of that, you don't need to scare them. So if I saw something that didn't seem quite good, and I wasn't expert in oral medicine and I wanted to refer the patient, I would say something like this. So Laura, we checked out your the gums, your soft tissues of your tongue, your lips, etc. Everything looked okay. There was one spot that looked a little bit unusual to me. I don't know if you've noticed it. It's just underneath your tongue there. We know that's a common cancer risk. It's just underneath your tongue there. And it's got this sort of wart-like appearance. It looks quite unusual. I know you said you haven't noticed it, so I'm hoping it's something that's just sort of sprung up recently. But it looks unusual enough that I think it's worthwhile investigating further. So I would recommend, Laura, there's an oral medicine specialist we work with. That's someone who just deals with this sort of thing. They're going to take really good care of you. It is unusual enough that I think it does warrant further investigation. They'll likely take some photographs. If they also are concerned, they might take some biopsies to cut it out to make sure it's not a lump or bump we don't want. So nothing to be too concerned about for now, but I think it warrants enough concern to go and see the specialist. Do you have any questions for me about that? That's it. And so effectively, we've made the patient feel that they're being taken care of, that we're guiding them through the process. We've got their best interests at heart. We've told them what's going on. And we've raised enough concern for them to take action, but not so much that they're like, oh my God, I have cancer. So, I'm using words like lump and bump, and it looks unusual enough to warrant further investigation. All these sorts of things where we're gently kind of leading them in that direction without being like, oh my God, I think you have cancer. Because the reality also is that even if it is something suspicious, probably the treatment most likely is really simple. They'll just cut it out and everything will be fine. Most of the time. Not all of the time, but most of the time. And then, let your friendly specialist do the scaring, basically.
I don't know if you've had the experience to detect oral cancer. I did.
No, I haven't.
I did detect one patient.
Cool.
It was obvious. It was just a big red, probably 2 centimeter lump on the back of his on the tongue there. I told him, "Have you noticed there's a lump at the back of your tongue?" And he's like, "No." And I said, "Well, you should potentially have a look at it. It could be something. It might be not. but I think you should see a specialist. But it was quite obvious. It looked quite malignant, I would say. But he wasn't very, he didn't take that message very seriously, because I didn't seem so serious about it. So it could have gone the other way, right? So then when sorry, there's a fly right in front of my head here. He didn't take it very seriously. So he didn't want to call the specialist or anything like that. And so I had to really tell him, okay, Mr. Smith, I actually think you should see the specialist. This is the number. We will call and make the appointment for you, just to make sure it's okay, or not okay. But in my limited opinion, I think this should be looked at further. So we did take the appointment. It was stage 4 cancer. Wow. And he did pass away a month later, unfortunately. So there was nothing much we could do. But yeah.
From the cancer?
From the cancer, yeah. It was really late stage, yeah. So it can happen. I mean, but at least he had a few weeks to,
So they thought this was like a metastasis, or?
Oh, it's definitely metastases. I can't remember where it was from. I think it was kidney. But yeah, these things can happen. There you go.
So I guess it's a balance, but yeah, I mean, just follow up with them. If I suppose is all you can really do. If you're really concerned, you're like, hey, Mrs. Jones, have you seen that person yet? Have you seen that person yet?
Have you seen them yet? Yeah. Okay. There's no other questions at the moment, so I'll just quickly pop this slide up here. For those who are still with us, who are in Melbourne, we do have a GDR study club this Sunday. It's a multidisciplinary day. We've got pediatric specialist, Dr. Ellis Brooks. We've got a periodontal specialist, Dr. Alex Kaminsky, and a orthodontic specialist, Dr. Katie Zhu, focusing on obviously those areas. And so all are welcome, dentists, OHTs, students. More information on the website. So that's that. Are there any other questions from anyone or any comments? Anything else you want to add, Dr. Daniel?
Nah, fantastic. Thanks so much for having me, guys, and appreciate a couple of questions we had in. Always makes for a bit more of a fun evening. Yeah, just email me if anything, and if you're looking for employment, we got a good gig, so get in touch.
There you go. We've got a hello from Mr. Krabs, but no follow-up question. I think it's just saying hey, hello. There you go. I don't think there's a question there. Okay, we'll end it then. Thank you, everybody. And we'll see you at the next GDR session, which is about mental health and resilience with Dr. Cajun. Thank you all.
Goodbye, Mr. Krabs.